Hi everyone, how are you? It is Dr. Splickle. Happy Saturday. I am a functional podiatrist, human movement specialist, founder of UBFA Global, and inventor of Naboso. So today we are speaking about 3 of my favorite tips to balancing your pelvis. And guess what? These 3 pelvic balancing techniques actually optimize foot function. So now when you think about pelvic balance, this means balancing the pelvis as it relates to all of its broad myofascial attachments. Your pelvis, your deep pelvis, your pelvic floor actually myofascially connects out into your deep hip rotators laterally. Your pelvic floor anteriorly blends into your transverse abdominals. Your pelvic floor posteriorly blends into the deep fibers of your glute max. And then when you look at it superiorly, you have your myofascial blending between the pelvic floor and the diaphragm. So we have an anterior, we have a posterior, we have a lateral, and we have a superior attachment to our pelvic floor. You also have a myofascial attachment between your pelvic floor and your feet. So this is going in every single direction. So now outside of just this myofascial spider web that comes from your pelvic floor, you also have triplanar mobility. So the ability to optimize your pelvic function, pelvic mobility is necessary for bipedalism. So when you think about balancing the pelvis, I want you to think about the important role that it has in standing upright and bipedalism. So these are going to be my top 3 techniques for optimizing pelvic balance. First one is going to be a release of your posterior pelvic floor. Now, why I like this mobilization technique is because a lot of people hold tension in the pelvic floor. They put their stress there. They think about keep contracting it, keep lifting it. Everything is about lift, 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 Pilates, tone, activate, activate. And sometimes we actually forget that we need to also release, relax, that the contraction up requires first a relaxation down. So I'm going to go through how I like to do a posterior pelvic floor release. This is to your posterior pelvic floor, your levator ani, but also your sacrotuberous ligament. And your sacrotuberous ligament is obviously going to blend into your hamstrings, and that's important for bipedalism as well. For this release, you're going to use a ball, something like a lacrosse ball. I have a Naboso Neuro ball, something similar to size. And then we're going to get seated in a chair. So in here, I'm going to be in a chair. Now, the harder the chair, the better. You can also do this on the floor if you would like. We're going to start by you finding your sits bone. So you have to be seated to find your sits bone. If you stand up and you try to find your sits bone, your glutes are in the way, too squishy. So you got to sit down, flex your hip to find your sits bone. You're going to take the ball and you're going to go just inside that sits bone. And then we're going to hang out here. We're going to hang out nice and relaxed, controlling how much body weight we want pushing down onto the ball. Now, if you want a little bit more intensity, you can lift your leg and lower your leg. That's going to increase the amount of pressure that we put on this release point. After we stay here for about 30 seconds, I want you to shift forward and to the right. So now I move to another position, just a little bit posterior on my posterior pelvic floor. Hang out here for 30 seconds, watch your alignment, lift your leg if you would like, and then finally we go to one more spot on our right side, go forward and to the right, and now you're just next to your tailbone. Don't be on your tailbone, just next to your tailbone. Hang out here, breathing and release, 30 seconds, and then we're gonna go to the other side. Same thing. I'm gonna find my sits bone. I'm going to place the ball just inside that sits bones, or your issue tuberosity, if you know the more appropriate term. We're going to hang out here 30 seconds. After 30 seconds, we're going to go forward and to the left this time to spot number 2. Stay there for 30 seconds. And then finally go forward and to the left. The ball goes closer to the tailbone. Hang out here for 30 seconds. Perfect. And then good release. So now by doing your posterior pelvic floor release, we're getting into that attachment to your posterior glutes. We're getting an attachment into your deep hip rotators, specifically obturator internus. Now, once we do this inhibition, I like to follow this with a pelvic outlet stretch. Now, pelvic outlet, you might be thinking, where is that? That's the base of your pelvis. That would be where the baby comes out, right? It's passing through the pelvic outlet. And what we want to do is we want to try to open that pelvic outlet. It's stretching the ligaments in the pelvic floor to open up and allow some optimization of movement of the pelvis, of the tailbone, of the sacrum, and all of the structures that blend into it. So for this one, I'm gonna move the chair just a little bit back. We're gonna start in a quadruped. I'm gonna move the ball over for now, and we're going to be in a quadruped position. So I have my hands down. You no longer see my head, but that's okay. And I'm gonna slightly tuck my pelvis. So I'm not in an anterior tilt. We don't wanna be like this. Slightly tucked, right? Also don't be like this. So flatten that back, head's in line with the spine, the tops of my feet are down, and then I'm gonna shift my weight back. And as I shift back, I'm actually feeling my sits bone spread wider. I'm trying to relax my pelvic floor, and then I'm gonna shift back, okay? So again, shift back. I can actually tuck my sacrum down to allow a little bit more opening and relaxation of the ligaments and the pelvic outlet. Hang out here, and then again, come forward. I like to do about 5 rocks in this position. And then your second pelvic outlet stretch, I'm gonna come forward just a little bit. You wanna tuck your toes, and then you're going to shift into a yogi squat. So in a yogi squat, you wanna have your heels on the floor, your chest is up, and I'm in kind of this goddess pose. I like to call it a frog also. Your chest is up, you're hanging out here, and now I'm also just allowing the base of my pelvis and my pelvic floor to relax. I could alternate this with this position. My hands go down, and then I fold over, and then I come back down to my yogi squat, and then my hands go down, and I fold over, and then I come down, lift my chest. I could bring my hands down, I could rock forward, right? So we kind of are flowing through this. So that's the second pelvic balance mobilization. First, inhibit the pelvic floor, release the posterior pelvic floor. Second, try to open that pelvic outlet stretch. Your third and final one is going to be opening up the front of your hips in a mobilization. And the mobilization that I show you is actually going to combine something with the T-spine. This is inspired by Gary Gray. So if anyone is familiar with the Gray Institute, love their work. So for this one, we're gonna stand up again. So we're gonna come up, I'm gonna move my chair, I'm gonna come here. Now for this one, I'm gonna bring one leg forward, the other leg back. So I'm in a lunge position. Face a little bit this way, lunge position. I'm tucking my pelvis under, and I'm gonna just start by pulsing my hips forward. So I'm pulsing, I'm gonna pulse 10 times. Perfect. After number 10, I want you to hold it forward. Your arms go straight up, nice and tall. And then we're gonna do 10 pulses in the sagittal plane. So we're gonna pulse here, still keeping that hip tucked under. Perfect. Holding number 10 back. Turn the palms to face forward. And now we're going in the frontal plane. So we're mobilizing here, doing 10 times, blah, 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 10 times, sagittal plane. Try to keep this position the entire time. After number 10, you're here, and we rotate in the transverse plane. Rotate transverse, la, 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 10 times, and then we repeat on the other side. Pulse 10, arms up, 10, frontal plane 10, transverse plane 10. Now to get a little bit deeper mobilization, if you can see my back leg, you can actually rotate it in a little bit. As soon as you do that, you're getting these muscles a little bit differently. Or if you would like, you can bring the foot on something and then come forward here, and you would get a deeper stretch, okay? So again, just to summarize for you, a balanced pelvis is one that is finding balance with the anterior, the posterior, the lateral, superior. The inferior is going to be your feet. So actually, I would probably add on a couple tips here and say that I would follow this with short foot diaphragmatic breathing, and then boom, 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 you get an inhibition, mobilization, activation with the diaphragm, and an integration with your feet and your core. If you are intrigued and you want to learn more, guess what? We have a course happening in exactly 1 week. This is our pelvic balance course. Pelvic balance was one of our newest courses that we introduced in 2019 and in 2020. We have it available online, and we do it in person, but I am doing it virtually next week. So if you want to join me, we have $50 off. So it's $200. You get the recording. It's virtual via Zoom. Tune in live, ask your questions, or just watch the recordings, and you can always ask your questions via email. This is available. You can sign up via ebfaglobal.com. The link is also under Instagram. And then on Sunday, we have a course all about interoception. So I'll be going live again tomorrow to talk about interoception. To learn more, visit EBFA Global, and remember, stay barefoot strong.